So, hello everyone. I want to thank you for being with us. It's a distinct pleasure for me to have Efrain Talamantes, physician, executive leader, and mentor, among many other things, including have a beautiful family, with us today. I'm Alan Miller with Cope Health Solutions and Cope Health Scholars, and I'm really pleased. Dr. Talamantes has agreed to spend a little bit of time with me today, just sharing some of his lessons learned in his life journey. So I want to start by asking Dr. Talamantes, would you mind introducing yourself to the group?
Yeah, definitely. Thank you, Alan. I'm a huge fan of COPE and continue to really stay engaged. And thankfully, Alan, I really appreciate you and your team inviting me to get interviewed. My name is Efrain Talamantes. I am an internal medicine physician by training. I currently serve as Chief Operating Officer for AltaMed, which is the largest federally qualified health center in the country. We're based here in Southern California. We serve both LA and Orange County, and we have approximately about 300,000 patients. Many of them are Medi-Cal, or what we would call Medicaid, and or uninsured, meaning they have no form of insurance. And it's a really exciting time to be in healthcare, both as a clinician, but also someone who's had the opportunity to have additional leadership training. And I would say that, my roots are in the community. I know COPE is really about community. And so it's really nice to be back and really share some thoughts with you and many of us who may have the same aspirations of giving back and serving.
No, I mean, you've been such a role model for that, Dr. Talamantes. Most folks don't realize, but I've seen that myself, and everyone who knows you know what a great leader you are in relation to giving back. And so I think that's a great way to start. What I think a lot of folks would be interested in knowing is, here's this guy who worked his way up, became a physician, clearly a passionate healer and clinician and researcher, and now he's in this role, which is an operating role, chief operating officer, right? That not necessarily the kind of role people would often think of a physician in. Sometimes you'll hear people say that physicians aren't necessarily going to be the operators. There's a dyad. You're such a unique person, but you're also in such a unique role. Can you speak a little bit to folks about how you made the decision to take a role like that, what being a physician means to you in that role, and also what that role means irrespective of being a physician to you and what you're setting out to do?
Well, yeah, I would say that one is being a clinician and being in an operations role allows us to really enlighten our operations teams. Many times they have no clinical background. And so really being able to walk them through what we live and experience, both as clinicians, but more importantly, how we care for patients. And I would say that that's probably the funnest aspect of my job, is that I continue to share my patient experiences, or many times where those experiences may fall short because operationally we may not have the system down. And I would say that, part of many of you are interested in possibly leading healthcare systems. And like I said, it's a really exciting time to lead in today's healthcare systems. The pandemic has really shown to us, that there's a tremendous amount of healing that our own healthcare system has to take. There's too many fractures, there's too many challenges that we face to care for more of our patients, really focused on population health. And I know COPE is a leader really in understanding how we move to value. And I would say there's no better time than for us to partner with not only our local agencies, but our state agencies and nationally to better improve our healthcare systems. One of the things that at AltaMed we found early on in the pandemic was a real need. Our clinicians were terribly afraid of, terrified of the pandemic. We didn't have enough PPE. We also didn't have enough understanding, and there was a lot of conflicting information coming out of our major associations with regards to how to respond to this. And really, as a community health center with limited resources in respects to how we serve the needs of many of our patients who not only need medical care, but they are also facing significant social economic barriers, was that we needed to work more collaboratively. And part of that was partnering with the cities and the counties to get PPE, to get testing, to really get our health centers the needed PPE and the testing to be able to test many people who found themselves in testing shortage areas. These are areas where there just wasn't enough COVID-19 testing. And when we saw as clinicians the opportunity to lead, that's where I came in. And you know, I joke around that I got promoted to Chief Operating Officer during a pandemic, and that's probably the toughest time to get promoted because it's crises. And so some of what I would encourage many of you is to look at additional training opportunities, whether it's a master's in public health, a master's in business. Also do fellowships. There's a lot of health services research fellowships, like the National Clinical Scholars Program now. And as a fellow, I had the opportunity to start to see a little bit of the systems changes that COPE was leading. I had a chance to do some consulting with COPE as a fellow, even though I hadn't finished my full training. And those were tremendous opportunities to look at, well, how do we address workforce shortage issues as a system? And I would say that's how I started to really understand that, one, there's a real need for us and those of us who are committed to transforming healthcare. And many of you out there are transformers. You're always looking to transform systems. And part of that is having opportunities like COPE to help you see beyond just the day-to-day. Yes, it's really nice to diagnose and treat and write orders, but there's a bigger world out there. And that's what I would say today in this many times divisive environment. Leading is going to require us to really figure out ways to think about what we've achieved in this great healthcare system, but more importantly, what we're going to achieve moving forward. And there's some really neat opportunities for many of you who have probably a lot more experience with technology than Alan and I do. We're sort of catching this in our later careers. And so it's really exciting to see what you're going to bring to the table when we start addressing some of the patient barriers with new digital technologies and what care is going to look like, 5, 10, 15 years from now. And so really, I mean, that's one of the reasons I continue to mentor is my students really do teach me a lot about the changing world, the younger world of healthcare. And that's really what we need is we need to continue to engage our young up and coming healthcare leaders. And COPE is exactly the opportunity to take on to get you to your next step, whether it's getting into a clinical program or a master's program or going on even beyond that and getting a PhD.
Thank you so much, Efrain. I mean, really well said. And, I would like to segue because one of the things you mentioned is you mentioned the value-based payment world, and AltaMed has always been, for many, many years, very unusual for an FQHC, right? Costello had the vision to create an IPA. You're now creating what's called a restricted Knox-Keene. You're getting licensed to be a health plan in the state of California. And so, again, as a leader in this entity that's always been in value-based payment and population health management and is taking it to the next level now, beyond even your PACE program, can you talk a bit about what you would recommend, particularly for some of the other folks out there who might be thinking about how do I prepare myself, not only for technology, as you discussed, but also for this value-based payment world we're moving into? But what are some of the things you'd recommend people to do to prepare themselves?
Well, one, I would say there's nothing like getting into a clinical setting and experiencing what is happening today, but also asking about the need for change. What are the changes that we need to make as a healthcare system to really deliver on our promise? And that is that we want to take care of our patients and we want to improve their quality of life. And that means outcomes, regardless of socioeconomic status, insurance. If they see me or they see another clinician across the way in another city, we do want those patients to receive the best care. that means that we have to communicate better. I do think that our healthcare system is young in its I would say stage of development. We have a long ways to go. I think technology is not only allowing us to be integrated and communicate. As AltaMed, yes, our CEO Cássio de la Rocha has well understood the importance of being ahead of the curve, but more importantly, thinking about how do we weather changes? I would say that as AltaMed, we wouldn't have been able to weather many of the pandemic challenges if it wasn't for this pre-planning. While we had already plans for telehealth, pandemic just expedited them. And so for us to be able to move from a handful of telehealth visits to thousands of telehealth visits per day is very important. And also ensuring that value is a transformation that not only we are going through, but our patients are going through. And many times the patient isn't included in that transformation. For our patients to really understand how to access care, how to make sure they're accessing the right care at the right time, right place is important. And I think that's something that is part of our DNA at AltaMed, is that we've always been patient-centered. And we don't take no for an answer, in the sense that there's always, these patients might be too poor to understand. We've always stood against that, and we've always said our patients can and will exceed our expectations. And that's part of the journey, is that we do have to create a better system that is a lot more friendly to patients, so that they're able to really understand what is value for them. And I'll tell you that in today's world, to be able to care for patients without them having to get on a bus and take 2-3 buses to get to my clinic is a real win for us, because we see that as a way for us to manage and keep their diabetes at bay, so that they don't end up losing a limb at the age of 50. And losing a limb, which not only is bad for their quality of life, but more importantly, it impacts their family. That's one less income potentially they can earn. And so that's the way that I would say we understand at AltaMed how important value-based care is, and that we do want to prevent hospitalizations and ER visits per se, not because it's costly in terms of money, but it is a cost to our community. And that's where disparities, and we keep a real close eye on these disparities, is we really understand the human toll of disparities, whether it's discrimination, whether it's intentional, unintentional, but how do we create systems, healthcare systems, that are a lot more responsive and easy to access? Doesn't matter what language you speak. And many other countries have proven that we could do this. And so for us to be in healthcare today and to be at the tip, the spear behind really transforming us, not just to be better, but to be equitable, is really exciting. And I do hope, part of, I would say, is not only being in clinic settings, but having mentors. I would say Alan, has always been an incredible mentor. I keep up with a lot of the sharings out of COPE. I read those. I go back to the articles that I reference, whether it's a health affairs article or another type of article in the clinical setting, showing if we make these nudges to our system, everyone's better off, not only the patients, but the clinicians. And we really contribute to the well-being of everybody in the system and achieve quality outcomes and satisfaction like we've never seen before. And that's, I would say, the real challenge for us, is that we're not just interested in one outcome. We're really interested in advancing what many of you know, or maybe have referenced or have seen referenced, the quadruple aim. And every time we have a discussion at AltaMed about value, we use the quadruple aim as a way to say, how do we improve? There's 4 areas that we're really focused on. And that's really driving our ability to really think beyond just what we do in the clinic. What do we do outside the clinic 4 walls?
That's amazing. And by the way, it is at the hour, Efrain. Do you have a little bit more time?
Oh yeah, yeah.
Or do
I
you
have
need
more
to?
time. Yes, I have more
Oh,
time.
cool. Okay. Well, the next question I'd like to ask you, I think something that a lot of, particularly the younger students who might be watching, but also look, some of the alumni who maybe like me didn't take a straight path and are now thinking about their next step.
Yeah.
You know, your story is incredible, you know, not only by virtue of where you are. Can you talk people through a little bit about what got you into medicine, what your journey was like to get to medicine and to get, again, you talked a bit about it, but beyond medicine to the various steps you've taken professionally?
Yeah, no, definitely. I'm the son of two immigrants from Jalisco, Mexico. They went to grade school for education, immigrated to here to California. And really what I grew up in was really depending on the safety net, right? My mom getting care in community clinics, accessing county hospitals, really not knowing how to navigate that all. So early on, I saw both as not only as a son of immigrants, but also an interpreter, that I had to figure out how to help my parents navigate this complex system. And through some very difficult challenges, I think many of us, as those that are experiencing healthcare systems for the first time, we know it's so challenging, and it's not just language; it's how easy it is to navigate, or I would say how hard it is to navigate, right? And how do we make it easier? And so that was sort of the first, I would say, phase of my life, was to really see that, but I didn't appreciate it. It wasn't until I was in college and I got involved in student groups where I started to see where the failures in our health system were. And in COPE, for example, it was the public health failures around just really including our youth, around getting them to do violence prevention. I mean, violence prevention out of, looking at what was happening in Venice through COPE was really a model. Then I got into the clinical setting to see again, it's like, well, wait a minute. I grew up, many years ago, and they were having challenges with communication with patients, whether culture, language, and why is that still happening? And to be able to see the impact I could make as someone who spoke two languages, English and Spanish, that was powerful. But what was even more powerful was the bonds I was able to establish with my patients. And in that case, I was a student, but they would say, "Well, you're my doctor," and that kind of I know many of you out there in the clinical settings experience that, where you get called a doctor even though you're a student, but our patients are already cheering us on to continue. And so whether you have to overcome another requirement, another course, or pivot, right? You finish a program and then you have to do another program. That's okay, because take it as a lesson. And I always say the greatest inspiration is get as close to your patients as possible, whether that's a personal experience or whether that's a clinical experience where you're volunteering. Because when you hear what the patients have to share with us, that's the greatest inspiration. And today, even when I'm in clinic, when I hear their stories and what they're having to overcome during these very stressful times, that's a motivator for me. That helps me motivate myself and my teams to deliver on better operational changes that need to be made for us to better care for our patients. And then mentors. It's really important, to surround yourself around people who've experienced healthcare for many, many years. Because one thing they can tell you that we won't know, we're really good at being, when we're young, to challenge the status quo. But we're not good at figuring out, well, why does the status quo exist to begin with? And that's where years of experience, conversations with, the Allens of the world and other alumni that I've had a chance to through some of the work at COPE, is why does it work this way? And you'll start to really understand that there's reasons for why things work the way they do. And there is going to be an investment on our part. And so again, additional training is okay. I think my parents would always question and say, well, when are you going to make your first paycheck? Because you're in your 30s and you still haven't finished your training. And I would say that that's okay, because the problems that many of us in healthcare are trying to solve will require more time and investments of ourselves if we're going to be successful. And so that's part of it. I would say that when I think about my story, it's always staying close to our patients, and more importantly, staying close to really the purpose of the why. And why is, I want to get back to my mom and dad who experienced healthcare in such a oftentimes traumatizing way. And I know we could do much better for them. And that's really where it's at. My patients remind me many times of my family and friends who have experienced some hardships in healthcare, and we could do better.
I think folks are going to really appreciate that perspective, Efrain. So if you think about now, again, all these students out there, right? And there's, we've talked about value-based payment, we've talked about telemedicine, we've talked about the need to stay connected with patients. Mm-hmm. And so as you look ahead for people who are entering healthcare and you look at some of the changes that you've talked about that you see coming, can you talk a bit about how you see those impacting career opportunities beyond physician and with physicians in terms of, okay, so what are some of my options, Dr. Talamantes, that you see out there? What are the hot careers in healthcare, if there are any? What are some of the things I should think about getting exposed to and learning about so I can make good decisions as to what's going to be good for me and also what's going to be important and needed in the future?
Well, I would say, yeah, healthcare as a field is expanding its ability to not only further appreciate the future, which is technology and better systems. I think engineers are starting to come into healthcare to really help us. But I would also encourage us, you know, and many great folks are coming from the traditional disciplines, the philosophers, the psychologists, behaviorists, folks that are really focusing on human-centered design thinking, really understanding society, because a lot of what we understand today in healthcare is that there's only so much we can do in that 20-40-minute slot. But we really do need to think about, and I really do appreciate this idea around health in all policy. So even if you're going to go into and become a politician, you're going to be better off understanding our healthcare system. Because I would say if you take GDP as a measure of how much time you're going to spend working on policies, 20%, over 25% of your time is going to be spent on healthcare because it's such a huge cost for us as a country. And we do need to look at how we're going to achieve better outcomes. And so many times it's redirecting our efforts to be more holistic. As clinicians, being more involved in advocacy and policy and you know, really sharing our experiences so that our policymakers can change these. So I would say, you know, and our CEO is a lawyer by training. So I would say there's probably a good mix. So if you're coming into the COPE program or any other program and find yourself, maybe this isn't right for me, maybe I don't want to be in a clinical setting, take those clinical experiences and take them with you. I mean, if you can journal what you experienced and what it felt like and what the patients told you and what they felt and what they experienced and what they liked and didn't like, and take that in the future, I guarantee you that in your future, whether you're building an app or creating a new system, engineering system to support healthcare, those experiences are going to be very important to guide you and help you be more successful. And I would say that's the biggest thing for me is I like to read probably a lot more outside of healthcare today, because there's a lot of other fields who have solved many of the problems, whether it was in banking, whether it was, you know, our behaviorists, politicians around behavior, whether it was really looking at the tech world and what they're doing to influence. not necessarily influence people to buy more stuff. I think we know how to do that, or the tech industry knows how to do that well, but how do we influence people to get their flu shot, and really get the right information around the safety and effectiveness of flu shots, and not get dissuaded by a conversation or misinformation, right? Having the wrong information. And I really do think our future lies in that, is how do we better look at our entire ecosystem, whether it's what we do in our cities, what we do in our schools, what do we do in our clinics, and really look at how do we prevent the next episode of severe depression that's going to lead to maybe a bad outcome like suicide. How do we do that? And I think today we have a lot more touch points where we are learning, but we still don't know how to get there. We still don't know how to connect all these dots. And so I would, challenge us to say, no matter what you go into, experiencing healthcare today or being in a clinical setting as an observer is such an amazing opportunity, because you're kind of the fly in the wall. And sometimes you're going to be asked to help, and that's great because you should help. But learning from that is probably something that you can take with you to whatever field you go into.
Dr. Talamantes, thank you so much for your time. You've been so gracious, and your story is going to help so many of our students. So I just want to thank you very much for joining us today, and wish you and your family and the AltaMed family all the very best.
Thanks so much, Alan. Appreciate you. Thank you.
Talk to you soon. Take care, guys.